Next we have Paul Moulton from Isle of Man Television. Good afternoon, Paul. Fast am I.
Hello. We've been at these press conferences now for some time with the question that's constantly been asked about how many people are suffering that hadn't been vaccinated. And up to now, Mr. Ashford in particular, you've said you cannot give this information. Yet today, now, under what is extreme pressure from the public, and I know you were on the radio yesterday and this was constantly being asked by everyone, now we can get some more details. Why have things changed now?
Well, we've been asking for them for all the time. The Council of Ministers are restricted by what our medics and data protection allow us to state. I don't know, David, if you want to expand on that.
In fact, we've been able to go off and compile the data because we've had permission to do so. And it's as simple as that. As I've stated all along, we actually need permission to be able to collate that information. We've been able to do that with the snapshot of the patients currently in hospital, and that's why we've been able to release it. But it's not guaranteed that we will always be in a position to be able to do that.
I mean, a lot of people see it as a way of just hiding things with this data protection. I mean, Sir Patrick Vallance, 20th of July, was giving out information on this very subject, and you've held back this long, and it's given clarity. Do you not understand how important, when you come in front of the public, to have clarity for people?
It most certainly is, Paul, but we also have to recognise we have to comply with the law.
So are you now... Sorry?
Hang on, Paul, just let me clarify further. We're a small island. So if I was to say there's one person in intensive care who's not, say, had the vaccine, that person is instantly recognisable. Sir Patrick Vallance is dealing with millions and hundreds of thousands of cases. So we on a small island, we have to get the permission of the people to state whether they are vaccinated or not. So whilst it's something, of course, it's important as a government, we want to get that message out there that the vaccine protects your lives. Now, for the first time, we've been able to get the permission, and the data clearly shows that a significant proportion of people in hospital with COVID have not been vaccinated, and therefore the importance of the vaccine. But that's not us wanting to hide that information, that's us wanting to get the information out. But we are restricted because of our small numbers on what we can and cannot say. But I'm delighted that we've been able to have that information to show the public the importance of having the vaccine.
So to get us quite right, you have wanted to do this information all the time, but you're being stopped by your medical advisors.
Well, we've been stopped because data protection rules mean that we have to comply with rules and regulations. Now, just because it suits us to be able to, we can't break the rules just because it suits us. We have to ensure that we have followed all the correct rules and regulations, and we have been advised that the people have been asked and have agreed to share whether they've been vaccinated or not. That's why we're able to share that information with yourselves. And I'm delighted that we can do that.
So that means that...
I also want to come in, Paul, and just say, to make absolutely clear, there's not some secret bank of information somewhere. So there's not a load of information myself or the Chief Minister has that we aren't sharing with the Manx public. The rules equally apply to us. I'm not entitled to that information, same as the Chief Minister, apart from where the appropriate permissions are in place. And those permissions in this instance have been able to be obtained. There will be cases going forward where we will be. If you look back over the pandemic period and all of the numerous press conferences we've done, there's been certain occasions where, for instance, I've been able to release postcode data, but when we had the low number of cases, we weren't able to do that because it was classed as identifying data. And this is exactly the same.
But you're relying, are you saying this, that you're relying on patients to tell you that they'll allow you to tell the public? So when you get other people on other days who don't want information out, you'll give out a number, but it won't be the right number necessarily, surely, because some people are going to hold back that information.
Where information isn't willing to be shared, we can't share it, Paul.
So the number you'll give us won't be necessarily the real... Sorry. The number you're going to give us won't necessarily be the number. It'll be just the people who have agreed for that information to be shared, yes?
Well, if people aren't willing to share their personal information, we have no power to compel them to do so. People have a right to privacy, and if they don't wish to share their personal data, then they do not have to share it, and that's the law.
So that number won't necessarily be correct. That's what I'm trying to get to. It's not actually...
It is correct.
This number is correct because everyone has shared the information. What we're saying is in the future and past, if we haven't got the permission... We cannot state that because, as I say, when you're down to small numbers, like if there was one person in intensive care and they weren't vaccinated, then it could be tied back to that one person. we're dealing with very small numbers on a very small island, and as I say, in the UK, considerably more numbers, so you can't be traced back. You have your anonymity in sheer volume of numbers.
Okay, thank you.
It's not a case that we don't want to. We have to follow rules.
Fine.
And in fact, it's frustrating, Paul, because a lot of the data, if we could share it, would probably give very good information around vaccination like we've been able to do today.
Okay.
But we do have to recognise that there will be occasions like today where we've got the data and we can share it because we have a full data set. But equally, there will be other occasions where we don't have a full data set and won't be able to share because, as you've just rightly said yourself, if we haven't got a full data set, then it doesn't necessarily give us the information that we want.
Okay, thank you. My second question, Dr. Hewitt, why are you not giving the information or up to now from your side, and are you still frustrated that Komen are not necessarily taking your advice?
I'm sorry, but I don't understand the questions. Data is released when we've got data that's of appropriate quality and with the right permissions to do so. And I don't know where you've got the idea that I think that Komen aren't taking my advice, because that's not the case.
Well, you said last time in a very roundabout way that they weren't taking your advice, weren't you? So, I mean, are they or aren't they?
No, I didn't. I said that the decisions sit with Komen. They take my evidence into account, as they do all other evidence. It's not for me to give opinion as though I expect that opinion to be followed. So from my perspective, so long as I'm comfortable that evidence has been taken into account and balanced with all the many things that government does have to take into account, then I will support that decision, and I certainly wouldn't go around saying that I didn't.
And that first part was just about what they'd said, that they were being withheld from the information by the medical team. Now, I don't know if that's you or whatever, but have you therefore changed your mind that this information also should be in the public domain, or what's gone on?
Data on the status of hospital patients is not public health data. That is owned by Manx Care. So I wouldn't have discretion to release or not to release that because I don't have it. It's Manx Care data, which they actually legally couldn't transfer to the Public Health Directorate unless it complied with data sharing agreements and GDPR. So that's not a block that I could put in, even if I wanted to put in, or that I could release if I wanted to do that.
Okay, so that is a question for Manx Care, but maybe we'll get someone from Manx Care to come on sometime, yes?
Okay, thanks very much, Paul.